Hello everyone, thank you for joining our webinar today on a harm reduction approach to substance use and early psychosis with Fred Crow and Alicia Hansen. I'll be turning things over to them shortly, but first I'd like to review a few housekeeping items with you all. Please remember to mute your computer speakers if you're calling in via phone. The computer speakers can be muted through Adobe Connect by pressing on the green horn above the presenter's pod. This webinar is being recorded and will be available for viewing at a later time on the MHTTC website. The PowerPoint slides and any additional resources discussed today will be available later today as well. During the presentation, if you have any technical difficulties or questions about the topic, you can use the chat and questions box down on the bottom left. Those attending today's live event will be eligible to request a certificate, and more information regarding CEUs will be in a post-webinar follow-up email. To reach us after the webinar, you can email newengland@mhttcnetwork.org. Our MHTTC's mission is to use evidence-based means to disseminate evidence-based practices across New England. Our area of focus is geared towards recovery through recovery-oriented practices and support services within the context of recovery-oriented systems of care. To ensure the responsiveness of our work, we will actively develop and maintain a network composed of different stakeholders from each of the 6 states to guide our activities. And to learn more about us, you can visit our website as well. And with that, it is my pleasure to announce our speakers today, Fred Crow and Alicia Hansen.
Thank you very much. So in terms of what I'm going to be talking about today, as Rochelle mentioned, I'm Fred Crow, and I'm a child and adolescent psychiatrist who currently works on the young adult team at the Massachusetts Mental Health Center, where we work with a variety of individuals with serious mental illness between the ages of 18 and 26, all of whom are Department of Mental Health clients. Amongst that population, probably about 50% or just over 50% have a primary psychotic disorder as their diagnosis. And many also have concurrent issues with cannabis use. Prior to my work there, I was the medical director of an adolescent inpatient unit at Cambridge Hospital. And so for some time now, cannabis use in my patients has been an everyday part of my professional life. And as a result, have learned a lot through trial and error in terms of what works and what doesn't work in trying to actually understand what's going on for these young people and how to help them. And so with that in mind, wanted to go through and convey some of what I've learned and how I found harm reduction to be a particularly useful model and frame of reference in terms of how to assess and also address substance use in early psychosis, and particularly in relation to cannabis. So, don't have any financial disclosures. Every single time I do this, I feel as though I'm missing out on something, but nothing to report. Do think that it's worthwhile in a talk like this to give some personal disclosures, given that it is such, at times, a contentious topic, and there can be a lot of debate around it. So kind of 4 disclosures along these lines. The first being, I've never done a webinar before, so I very much apologize if I'm looking at the wrong place or seeming even more awkward than I typically do. Secondly, I'm from Colorado. I'm very proud of being from Colorado, and I actually do appreciate that Colorado was one of the first 2 states, along with Washington State, to go ahead and legalize recreational marijuana. And in that, I just appreciated that it kind of took a lead in terms of thinking outside the box. Then, also worth mentioning that, like I imagine many people listening to this webinar, I was required to participate in DARE while I was in 5th grade. And we had maybe 80 kids in my 5th grade class separated between different homerooms. And of those 80 kids, I was the only one that did not graduate from DARE. So, and I should mention it was not because I was busy getting high in the bathroom. It entirely had to do with the fact that I had not turned in my worksheets. But nonetheless, I do think that it's actually pertinent, and I'm now kind of proud of having failed there because of the fact that when working particularly with young adults, the whole idea of just say no really does not get you anywhere, except a lot of young people telling you that no, they're not using substances, and many of them will just be lying because they know exactly what it is that you want to hear and why. And lastly, I do think that it's pertinent and worthwhile to mention that I too, Fred Crow, have smoked cannabis. And I think in everyone getting kind of ready and really warmed up for this talk, it's useful to think about the context in which that occurred to get us all kind of back in our adolescent and young adult mindset. And so then, I should say that growing up when I got into high school, really was kind of a good kid and kind of overly focused on rules in many instances, and it kind of thought in my mind, well, you know what, I'm sure someday I'm going to drink alcohol, but I'm going to wait until I'm of legal age to do so. And drugs, like, I'm definitely not going to do drugs. They fry your brain and everything else that Dare taught me. And then fast forward to my sophomore year, and I was at a party on Halloween where the parents were out of town. And so there were a group of young people all hanging out. Some were drinking, some were not. And I was amongst the group that was not drinking and clearly appeared to not be having nearly as much fun as people who had been. And so when one of the girls in attendance, who I actually thought was pretty cute, went ahead and asked me if I wanted to drink, I went ahead and said sure, but I didn't want my peers that also weren't drinking to know because I didn't want them to feel abandoned. And so I ended up drinking vodka out of a coffee mug so that I could be drinking, but so that people wouldn't know that I was drinking. That was actually a horrible way to first experiment with alcohol. Ended up going home. Thankfully, I made it home safely. And then for whatever reason, took off all my clothes and took a nap on the bathroom floor. This led to my mother coming in, being shocked and panicked, and my younger brother, who was in middle school, saying, "Mom, it's okay, I think he's just drunk." My mom, of course, given that I was her oldest son, was like, "No, there's no way my son could be drunk. He must have been drugged. Someone must have put something in his drink." But no, it was just the vodka in the coffee mug. And I did not know how to restrict my limits. And then fast forward again to my junior year, though I had that slip with alcohol, I was still very set in, like, no, drugs are bad, including cannabis. And so for my junior year, my parents went out of town for the first and only time during my high school career. And I ended up doing what any rational teenager would do, and I threw a party. I, of course, invited the girl that I had a crush on at the time. Her name was Julie B. I hope it's all right for me to go ahead and just use that last initial, but it makes things more real in my mind. And basically, she got there. I was very excited that she got to the party. And not long after she'd been there, she asked me if I wanted to smoke some weed with her. And so I was like, yes. And just like that, everything else that I thought previously went out the window. It was only what was in front of me. And like, oh my gosh, this girl I have a crush on is talking to me. Like, yes, I'm going to say yes to whatever you ask me to do. So just think it's useful for people to go back and think about their younger selves. In terms of other reasons why I think it's important to talk about, it was notable to me when I was thinking about taking this job with the young adult team, when I met with the clinicians on the team and asked if they had any questions for me, the first thing they asked me was how I approached the topic of cannabis use in young people. And I gave kind of a nuanced answer, and then realized that the biggest thing that they were actually looking for was someone that wasn't going to take the just say no approach, because that immediately is going to be a roadblock. And as many of you listening to this know who work with young people, engagement is central to everything that we do. Then there's just a matter of general prevalence of cannabis use. Perhaps most importantly, there's also the issue that it's complicated, and it's not as though marijuana use is good or bad. And that's something that in today's world, depending on where people go and what their previous beliefs are, they are just going to find stuff on the internet that really reaffirms their beliefs. So either it is destroying our society and going to ruin an entire generation now that we're allowing it to be legal, versus the other extreme that everyone should be smoking weed, it's healthful, and it can cure everything. And finally, there's something to give an FU to pharma. But clearly, things are not that simple. And then, in terms of the recent legalization, I actually think that it's worthwhile to consider what some of the possible upsides are, since much of the focus has really been on what the potential negatives and consequences are. So with regard to the upsides, I don't think that anyone, including everyone listening to this webinar, is ever in a rush to tell any of their healthcare providers about the legal activities which they are engaged in. So I just think by making it legal, at least on a statewide level, then it frees people up to talk about it because they don't feel as though they're confessing to having done something that's illegal. While it still is on the federal level, obviously many of these young people are not that nuanced in their thinking around some of these issues, and like they hear they have the green light, they're like, okay, things are okay. Then I think that there's also very much the decreased chance of legal issues and arrests that for the vast majority of the young people that I work with don't see as actually being a useful or helpful intervention for them. Well, I don't want to overly generalize and presume that all drug dealers are in it just to make money. I would guess that many of them aren't too concerned about their customers and customers' well-being. And lastly, the piece that there can be some increased transparency and regulation, and that people know what it is that they're getting, and there's some kind of controls in place to kind of look out for other adulterants, other things that can be mixed in, and even things such as pesticides and funguses that can lead to additional health risks and harm associated with cannabis use. And so this is a definition from Harm Reduction International. It's specific to substance use. But I think it's important to keep in mind that harm reduction as a concept can really be applied to most anything, and that, in essence, all human behaviors are associated with some kind of risk. And so the focus with harm reduction really is much more on how do we make things safer for everyone involved, as opposed to focusing on the quantity of substance use. While certainly decreasing the quantity and the amount of use will often decrease the harm, it is kind of a critical element that's not central to harm reduction as a whole. And so just to mention kind of where harm reduction came about, really its origins were in the early 80s as an alternative to abstinence-only programs with regard to substance abuse treatment. Most commonly, especially today, people think of it in relation to IV drug use, but as I mentioned, it can be applied to many behaviors. And so in this, and especially now that I have young kids myself, it's become clear that basically every pediatric visit that you go to is all about harm reduction, and that much of the counseling that the pediatricians are doing are on things such as helmets, seatbelts, sunscreen, and things that people in the community can do to decrease the risk associated with a whole broad range of different behaviors. And so just to kind of hammer home some of the principles of harm reduction, it really is about meeting people where they're at. And if people don't want to change their use in terms of how much they're using or don't want to stop using it all, you can still talk to them about how to use in a manner that's safer. A common misconception is that harm reduction kind of turns a blind eye towards risk, when really the opposite is much more in line with the truth, which is the focus is all about what the risks are, and kind of moving it away from the drugs themselves and the judgment away from the drugs themselves. And it also sees substance use as a continuum. A few other principles here. It's also important, like if a young person comes in who's been struggling and trying to cut back on their use, and they say, guess what, like, I only used once this last week, but I went to this party and I did get really messed up. As opposed to like trying to jump into where the wheels came off and like, why the heck did you have that night? Like, how did you screw up? What were the triggers? You'll get much further focusing on the positive in terms of saying, that's great that you were able to abstain the rest of the week. Like, what worked then? And really kind of leading off with the positives before kind of getting into more of the negatives or anything that can be additionally shame-provoking. Harm reduction takes into account the perspective of people who have used and continue to use. And lastly, it very much recognizes that some of the policies themselves related to substance use can increase risk, not just to drug users, but to society overall. And then just turning to young people, I've kind of been alluding to this throughout, but it fits with what we know about them in that experimentation is the norm, and they really are looking to what's right in front of them and what really fits with their interests. So going back to the party I was at, like, the cute girl I was into kind of trumped everything else, and that was where my sole focus was. There was also the piece that it's usual and typical for there to be a desire for autonomy and a rejection for authority. And so going back to kind of where people get their information, one thing that I find useful about this is that where young people often go to find information about cannabis is websites such as High Times and Leafly. And if you go to their websites, actually on their homepage, you can find links to harm reduction. So I actually think that it's something that they might see elsewhere in a place where they kind of trust and look to get information. Obviously, I think it's important to consider primary versus secondary prevention. And lastly, motivational interviewing in and of itself, given the importance of autonomy, fits as a tool for this population. And I should mention, to be clear, just so that there's no misunderstandings, I do, as a psychiatrist and personally, think that cannabis use impacts people differently, and I think that it's very similar to other things such as alcohol in that people can use responsibly. At the same time, use can quickly become problematic for people. In addition, there also is the factor that use is associated with different risks for different people. And as a prime example of that is for individuals with psychosis. And there, to be completely clear, I think the evidence is very clear that young people with psychosis should stay as far away from cannabis as they can. Just that being out there, though, there's no way that I'm just going to be able to convince them of that. So now I'm going to actually shift a little bit and do a little bit of a role play with Dr. Hansen, who's a resident from Brigham and Women's Hospital, currently in her third year, who's rotating with me at the young adult team. And she is going to be Alicia, which is her real name, but kind of channeling the persona of several of the young people that we work with. And just to kind of give people an example of kind of how I go about this in practice. And then after we do this, I'll go through and address pieces that I maybe did not cover during that portion. So to get started with that, Alicia for this purpose is a 23-year-old young woman with a history of schizoaffective disorder, bipolar type, who's had 2 psychiatric hospitalizations. Both were involuntary and quite traumatic, who currently resides in her mother's home, also has a younger sister who's still at college. And she had her first episode when she was a junior at the age of 21. And at that time, though she used cannabis some, started actually using quite a bit more when her symptoms were really coming about. And symptoms for her at that time included generalized paranoia, thinking that people were in some way conspiring against her, hallucinations, hearing both the voice of God and Satan, and lastly, kind of delusions around being a prophet and feeling that it was their purpose to spread love and peace throughout the world. And so in my work with Alicia, she is now working on getting back to school after having spent 2 years out of school. She'd previously made some substantial steps in terms of decreasing her cannabis use. And just now, a couple weeks ago, started back at school, and this is my first visit seeing her after she goes back to school. Oh.
Hey, Dr. Crow.
Hey, Alicia, how's it going?
Pretty good. Yeah.
And been able to do anything fun or exciting since the last time we met?
Nothing too exciting. I'm back at school. Like
Oh, you're back. That's
about.
right.
Yeah, but other than that, nothing too different at home.
Oh, I know you were really getting ready for that. How's it been?
Yeah, it's okay. Yeah, it's pretty good, I guess.
Pretty good?
Yeah, I've been looking forward to this for a long time, and I'm really excited to be back. My major's awesome, graphic design. I think we talked about that, but it's a big change from going from being at home with not much to do, and now back at school, having to go to class every day.
Mm-hmm.
And now when I'm at home, I gotta study, so I don't know. It's been kind of stressful. Quizzes, tests, projects, but I don't know. I like it. It's stressful. My anxiety's definitely coming back.
I can imagine. I mean, I noticed in the pause, like, while you said pretty good, it sounded like it was maybe a little bit more complicated than just pretty good.
Yeah, it's definitely harder than I expected.
Has there been any part in particular that's been the most challenging?
I mean, it's definitely weird being back at lecture and there's all those people around. And yeah, I think just worrying about, like, when I have a test coming up, just thinking about it, I really want to do good. I feel like this is my one chance to do good. And I don't know, so I just spend a lot of time worrying about that, especially before I go to sleep. It keeps me up.
Mm-hmm. And so, with all that stress, and now also having it starting to affect your sleeping, has there been anything that you've been doing to try to, like, take care of yourself or to try to help manage the stress?
Well, I know we've talked about this before, but really the only thing that's been helping me is smoking weed, and I've definitely been smoking a bit more, and that really helps with my sleep, my anxiety.
Mm-hmm.
So yeah, I have been doing that a little bit more.
And so, it's been helpful in terms of the stress, also helpful in terms of falling asleep. I mean, it sounds like at the moment, any help that you could get is a big benefit.
Yeah, I mean, it's to the point now where, like, if I don't smoke before bed, I really can't sleep very well at all. And if I can't sleep, it's so hard to go to class.
And have there been any drawbacks to starting to smoke a little more again?
I mean, so it definitely helps with my sleep, but now I have started to notice
lately that if I don't use it, I really can't sleep, and that's a little weird to me because I don't want to rely on something. Like, I don't know, what if I can't get it? I don't want to feel like I'm trapped. And then I have actually just in the past few weeks, like I've tried it at school a couple times when I get super anxious, like about to have a panic attack. So I have been smoking at school sometimes, and usually it's okay, but there's been a few times where it was kind of bad. Like last week I had this test. I was super stressed about it. Like I only had like 2 days to study. I really put it off. But so I smoked, but then I was too high to study. So then I felt better when I smoked. I wasn't anxious about the test, but then like afterward I was like I had a day less to study. And then one time I did smoke before a class, and I was really nervous because it was going to be like really important and the stuff was going to be on the test. But then I got kind of paranoid in the class, and I felt like everyone was looking at me, and I actually had to leave early because it was kind of tripping me out. I think I just smoked too much. It probably would have been fine if I just smoked like half the joints of the whole thing. But yeah.
So it's definitely helped with your anxiety, both for the studying and then, well, it helped for the studying and that you were no longer worried, but you couldn't actually get your work done.
Yeah.
So that seems like it's awesome. What kinds of things did you get paranoid about in class?
I felt like everyone was kind of staring at me, and then even when the lecture started, like, people were texting each other. I couldn't focus on what he was saying. I just kept looking around at everybody. That's the kind of stuff that, I know you know, like, before I was in the hospital, I don't know, that stuff kind of scares me, because that was a sign things were going bad, but, it wore off, and it was fine, but, yeah, I think maybe it just needed to smoke a little less before that class.
Well, I know you mentioned a lot of times that the hospital is not at all a place you want to go back to.
No, definitely not.
And I do think that you've been doing great in terms of making progress to do the things that you can to help with that. Like thinking back to getting you started on the in-phase Sustena and just having you consistently on medications, I think it's been a big help. I'm excited about school from the standpoint of having structure. At the same time, I think we really got to think about what's going to be helpful for all the stress. Is it fair to say that the weed maybe helps with some things, but not so much with the actual school?
Yeah, it definitely does help with sleep, which I need for school, but yeah, sometimes it kind of gets in the way. Then, yeah, also sometimes too, like with my art, I feel like it is helpful with that. Like I definitely sometimes I sit there and like I got a project I'm supposed to do, and I just I don't know what to even start on, and smoking definitely makes me feel more creative, more artistic. So it does help with that too. But yeah, sometimes it's backfired on.
But I can see, especially given that you're doing graphic design, that being very helpful. You feel it makes you very more creative at times.
Yeah.
But I heard you say a couple times you think, at least in terms of the situation in class, that you've not had paranoia like that for a while. I hear you saying that had you maybe smoked less of the joint, you think you maybe wouldn't have gotten as paranoid?
Yeah, I think, I just didn't want to waste it, the whole thing, I'm not just going to smoke, like, a puff or two, so, yeah. I've I've actually been thinking, like, I know a lot of people vape and stuff, and I was actually thinking about that, because that, I mean, kind of controlled a little more, and it's kind of just great, too. Like, I could bring it to class. And even at home, I've heard you can't smell as much, so, like, my mom gets really mad when she can smell the weed, and she really gets on my case, so it'd be way more convenient.
And so we can definitely come back to that in terms of thinking about kind of some of the different means you can use. But just to get a sense so that I understand things as well as I can, you mentioned you were smoking a joint. Do you typically smoke joints?
Yeah, just joints, really. Yeah.
And with that now, lately, how many times a day would you say that you've been smoking?
I mean, recently, definitely most nights. Sometimes on the weekend, if I'm bored or I need to work on a project, and then, yeah, maybe a few times during the day at school. Yeah, that's kind of new. It used to be like I would just use it at night sometimes for sleep, but yeah, now it's a lot more. Like I'm spending like $50 a week, and that usually like it used to be that would last me several weeks. So it's been a little bit more recently. It's expensive.
I remember the last time you said it was $50 a month.
Yeah.
After you cut back quite a bit. And so, with that, when you're smoking the joints, typically with yourself, like by yourself, or with friends?
It's mostly by myself. I mean, sometimes my little sister comes back on the weekends from college, and I'll smoke with her, but yeah, it's usually by myself. Yeah, definitely at night, it's just in my room, kind of chilling out before bed.
And do you roll your joints with just weed or also with tobacco?
Just weed.
Just weed?
Yeah. Never been that into tobacco.
It's not good for you?
No. Yeah. Lung cancer.
And so, just to make sure I'm getting it all, anything else that you really enjoy about smoking weed? Because I know you kept doing it even before you started school when you weren't as stressed.
Yeah. I mean, one thing I kind of like that, like, I don't know, it has been kind of lonely, and sometimes it is nice, like, you know, I'm relaxed in my room, nighttime. I do, like, sometimes when I smoke, I hear those voices we talk about, like, they just get, I mean, they're there during the day sometimes, usually when I'm stressed out, but when I smoke at night and I'm relaxed, and sometimes when I smoke, I can hear them a little louder, and that one voice that's good kind of sounds like an angel almost. Sometimes it's really nice to hear that. It makes me feel better, and I kind of missed hearing that, especially now when like school's so hard. It's nice to hear that voice, kind of encouraging. So I do sometimes like that, and like it wears off, like, but.
But I mean, if you're feeling stressed and lonely, like, hearing the voice of someone that cares and is encouraging, I could see the appeal of that.
And I've heard a lot less since I started on the shots and medication, so, yeah.
I know you mentioned sometimes you miss that. How's things been with the more negative voice?
I mean, yeah, that's the downside, is that sometimes that comes back too when I hear the good voice, but I don't know, it's kind of worth it to me.
But you can't totally control which one's going to get
loud. No, I just hear what I hear.
And in terms of the cannabis that you're getting now, where do you buy it from?
So this is a guy I knew in high school.
And just so you know, not to like get anyone in trouble, as you know, I'm just curious, more than anything, to simplify things. Do you get it from a kind of one of the dispensaries that is now open, or do you get it from, like, a friend or on the black market somehow?
It's just my friend, yeah. I mean, I trust him. I feel like he's selling me good stuff, but, yeah, I don't go to the dispensaries.
And have you noticed any differences in terms of, like, sometimes you get weed from him and it's very helpful, and other times it might make you a lot more anxious or paranoid?
Yeah, I mean, I guess sometimes it's different, but, yeah, I don't know. I can't really tell. I guess it is different sometimes. I don't really ask what he gives me, though. Like, whatever he sells me. Yeah.
Well, I really appreciate you sharing all of this information in terms of what's been going on, Alicia. And I'm glad that you're back at school. I'm sorry to hear about how stressful it's all been. With the cannabis, just to get a sense of where you're at, like, do you feel the time out you've been using is kind of, and how you've been using the way that you want to keep it, or do you feel that it's something that you're interested in making some kind of change?
I mean, there's some parts I want to keep. Like, it really helps me for sleep. But it is getting kind of expensive. So I was actually going to ask you if there's, like, anything else I could use for sleep. And then, yeah, I mean, it's getting expensive. My mom gets on my case. And I just, like, yeah, like I was telling you with the sleep, I don't want to, like, rely on it. I feel like I'm, like, have to use it. But yeah, it definitely helps me with something, so, I don't know.
So still kind of trying to sort it all out.
Yeah.
And again, and this can be something that we can keep talking about on an ongoing basis. As I mentioned to you before, like, I'm not going to approach you or treat you any differently based on how much you're smoking, and it really does give me a helpful sense in terms of what's going on, so that I don't just, like, increase your medicines when you're hearing more voices because you want to when you're smoking weed.
Yeah, I don't want any more medicine.
And I know you don't. So that's helpful for me. All of that is very helpful for me to know. And I definitely think that there are some things that we can talk about in terms of looking at other things that might be beneficial for sleep, if you want to try those on occasions. I know you mentioned the thing about the vaping, and definitely that is complicated from the standpoint that, like, yes, it smells a lot less, and it would probably decrease conflict between you and your mom, that I certainly think would be a positive. One of the issues there has been, there's been this whole rash of vaping-related lung injuries.
Oh, yeah, I heard about those.
And so it's still kind of uncertain what's going on. It does at least seem pretty consistent that it's mostly distillate vape pens that are sold on the black market that carry the risk more so than the ones that are kind of regulated at the dispensaries.
Okay.
And I was going to mention, like, one thing we can also in the future spend some more time talking about is just the dispensaries, because they'll have several different options available, and also thinking about other things. Even if you are going to continue to smoke, like if there's something other than joints. As you mentioned, you don't want to waste any, and you actually have the full joint on your own. One thing that a lot of people don't actually realize is that in typical joints, even in a small joint, there's usually like 30 servings worth. And so, and you're saying you want to save money, and that when you smoke too much, that's when things became more of an issue. So, I think even just looking at other ways that you could smoke like less at a time and then not worry about wasting
that would be really nice.
stuff, and maybe not get to that extreme.
Yeah.
And kind of the whole thing that you can have a little bit more if you want, but don't feel stuck like, I got to do this or else I'm going to like throw away this huge roach.
Yeah.
So, but let's definitely keep talking about it. I'm glad you're back at school. Yeah, keep this conversation going.
Yeah. Well, thanks, Dr. Crow.
Yeah, thank you, Alicia. So, um, thank you very much, Dr. Hansen. That was, in many ways, the kind of conversation that I often have at work. And so there, going into just some of my thoughts around assessing use. I think that it's critical to recognize that most young people, and even older adults, when it comes to things like alcohol use, cigarettes, cannabis, and they go to see their physicians, people are quick to minimize use because they walk into the situations expecting that their providers are going to have a strong stance against it. And kind of what I'm always going for is really creating a safe and open environment for my patients where they are able to have an honest discussion and dialogue with me in terms of what is actually going on. And so with that, I would say when I'm doing my initial assessment, I often start out pretty early on by asking people about the kinds of things that they like to do. Given that cannabis use is such a prevalent issue and the added risk that it carries for psychosis, I always am trying to listen for like pleasurable activities that people do that they often find cannabis helps enhance. So when people tell me that they enjoy going for like long walks in the woods, it's something that kind of makes me think this may well be an issue. If someone says their favorite TV show is Family Guy, and they really enjoy the disjointed nature of the show, that might be another suggestion. And then I would say when I ask about substances, I actually now always start out by asking about cannabis even before alcohol, and phrase it as, do you smoke much weed, as opposed to asking it as a yes or no question. So that kind of the default answer is yes, and kind of showing that like even my expectation on some level is that young people have tried or experiment with it, but just really leaving the door as open as possible. And then also in terms of quantity, that's something else that becomes really critical, because drinking a glass of wine every day is not the same as drinking a fifth of vodka every day. And with cannabis, there really is the same range, if not even a broader range, in terms of what people typically use. And so once I know that people are using, I'll go into things like what they like doing, who they like to smoke with, how often and when, by what means of ingestion. Then a key question that gives a lot of information is actually whether young people are buying their own, or whether they just do it if they happen to be at a party and a girl they have a crush on asks them if they want to smoke weed. Because those are two very different things. And to kind of approach the latter as someone that has an issue would really be kind of missing the mark and end up being that same thing, like them thinking, oh, I shouldn't be using, I shouldn't talk about this. And then really trying to quantify and get a sense. Their money I often go by, and just for what it's worth in my own practice, I tend to get more concerned if people are smoking or consuming more than an eighth of an ounce of cannabis a month, and do find an eighth to be a kind of quantity that a lot of people understand and can relate to. In many places, right around $50 buys you an eighth on the street, or maybe a little more, but the equivalent to that is like 3 to 4 grams. And so then they'll also ask things like if they're standing in a circle with their friends and people are passing a joint around, are they someone that the joint gets stuck on and kind of they will take any extra puffs that they can? Or are they someone that just want to like seem as though they're part of the crowd and will maybe take a hit, but not a long or a large hit, and kind of pass it along as quickly as they can? And then I would say I do find it to be a really useful thing to ask about in terms of if someone's prodromal or trying to get a sense if they might have emerging psychotic symptoms, is asking people whether they've ever had any odd or unusual experiences when they've been high, such as overt hallucinations or paranoia, but really like paranoia beyond the typical paranoia that anyone and everyone gets when they smoke cannabis. So there I would say most 16 to 20-year-olds, and maybe even a little older, if they're smoking weed in their parents' basement, are going to get a little bit paranoid and concerned that their parents are going to catch them and find out that they're smoking weed, and that they can get in trouble, and then even thinking about the consequences for it. But starting to think that someone's coming to kill you and not knowing why is either someone's had way, way, way too much, or it can be an indication that there can be an underlying psychotic process or predisposition towards psychosis. Then also checking, are there people they like to get high with and people they don't, just because it can give you a better understanding of their use and kind of what it is that they're going for. Similarly, asking if there's things that they avoid doing when they're high, that can really be a useful in terms of trying to get to some of the negative aspects about use without asking directly and explicitly for the negative aspects. And then asking, is there anything that would ever make you worry that you are using it too much or that it's not good for you? Just to kind of get a sense if they have any like thought out anchors for themselves. And so here, just want to spend a brief moment kind of conveying some useful information, because one of the things that's kind of tough with cannabis is that unlike alcohol, where it's kind of so commonly known what the servings are and what's typical, and that like a glass of wine is okay, a bottle of wine is questionable, 2 bottles of wine, definitely a no-no. Like many people don't have that kind of sense about cannabis unless they've had more direct experience themselves. And so with that, one key thing is the difference between smoking and ingesting cannabis by mouth. And so there, the bioavailability is actually usually quite a bit lower if people ingest it by mouth. It's also a little bit less predictable in that for the same person it can vary quite a bit how much they absorb based on things such as when was their last meal and what was it. And then the other thing that's challenging, particularly with adolescents and young adults who are certainly not known for their patience, it takes a long time for people to actually experience the peak effect. And this is something that actually came up as one of the clear negatives in Colorado, was that the number of ED visits for people with acute cannabis intoxication greatly increased. And there, one thing that was really interesting about it was almost entirely people from out of town who came to try cannabis who actually had not had a lot of experience with cannabis. And then, as a result, ended up eating far more than it would have taken to potentially have a more enjoyable or pleasant experience. Then just to kind of mention strains, and these are rough, and again, if people are getting it on the black market, typically they don't know what they're getting. At dispensaries, people can get a little bit more information. So the people that work at dispensaries often referred to as bud tenders. There are the indica strains that the easiest way I find to kind of remember them is indicouch, and so thinking that they're the ones that kind of make people more calm, more sleepy. They tend to have higher concentrations of CBD as compared to their sativa counterparts, and that's thought to have some kind of mitigating effects on the anxiety they produce, as well as potentially even some of the propensity to exacerbate psychotic symptoms. And then sativas tend to be much more activating and energizing, They tend to have higher THC concentrations and less of the CBD. And there I would say my usual advice if I'm dealing with someone with psychosis is to encourage them as much as possible, if they are going to continue to use, to go towards indica strains. Because while obviously negative symptoms are a huge issue and concern, when thinking about kind of acute safety and consequences, I think the sativas, with their energizing effects and activating effects, can be much more likely to exacerbate underlying positive symptoms in a way that quickly can become problematic. And so, in terms of how I set the frame, I always let young people know when I give them my little spiel about working with me that their treatment is not going to be dependent on them being abstinent from substances. Also that I'm not going to judge them or treat them differently based on their use. I also typically tell them the same exact thing in relation to medication adherence, because, again, I feel I don't care so much about the information that I get as much as I care about getting accurate information that I can then do something with, as opposed to being completely led astray. And kind of as I was talking about with Alicia, it's the type of thing that gets overlooked all the time, that someone might actually appreciate some of their psychotic symptoms, and trying to say, like, oh, this is making your voices worse, you have to stop using right now. If that's actually something they like, it's going to be entirely counterproductive. And with that, I would also say that I do view use differently even in people with psychosis on the basis of whether they're taking medications and taking them consistently. While I think all of them should avoid cannabis, I'm more concerned about it in the ones who are off medications. And then, again, really try to emphasize that I'm a safe, trusting adult that can be thought of as like a reliable source of information, and I will tell them what I know and the limits of what I know. And there I'm very frank about the fact that this is an area where tons is unknown. And so these are just some kind of quick guidelines in terms of harm reduction approaches that people can take. I definitely would say I view synthetic cannabinoids as very different and much more concerning for everyone, but especially with those with psychosis. And then strategies just in working with patients, talking to them about pacing themselves, knowing themselves, also knowing the products that they use, given the variability involved. Encourage them to choose products with lower THC concentrations or more balanced THC and to CBD ratios. And then education around serving size. And that before, often, like in Colorado, they would commonly sell brownies that would be 100 milligrams, whereas 5 milligrams would be adequate to produce psychoactive effects. So people that were like, oh, it's a brownie, like, of course I should eat the whole brownie, things did not go well for them, even if they had no predisposition towards psychosis. And then I do often role play with my patients if they're saying that they want to use less, in terms of telling them, like, well, if you are at a party and if the girl you have a crush on asks you if you want to smoke weed, what are you going to say? Because I think it's very different to say something in the moment with your provider. And while you can't completely simulate the experience of being in those more emotionally charged situations, you can at least bring them to mind to help people think ahead of time of how they might respond. And then lastly, suggestions if people are saying that they want to cut back, things such as not buying in bulk and having kind of a set quantity that they're going to allow themselves to have, planning ahead, and by that I mean often like having, if people are smoking multiple times a day, just saying, well, why don't we decide that you're going to wait, like you're going to give up the whole wake and bake thing for a little bit, and we're going to decide upon a time in the day that you're going to wait until, and then at that point on, you can smoke. But before that, you're going to try to have most of the day clear-headed. It can often be useful to just throw out 4:20 as the time that they want to wait. But really anything works. I encourage young people to let their friends know, and telling them that if your friends are real friends and you tell them ahead of time that you're trying to cut back, most of the time people are going to respect that. And then also talking about the situation of people who are standing in a circle and passing around a joint. And then none of their friends are going to get mad at them for passing a joint. They might get mad and frustrated if someone doesn't pass a joint, but if they just pass it, their friends usually are not going to care. And the other thing, if they feel like to be included and not feel more isolated, they need to take a hit, then they can just take a smaller, briefer hit. That's going to be a decreased quantity overall. So that's pretty much everything. Happy to answer any questions that people may have. So, in terms of is the ultimate goal of harm reduction abstinence, I would say no. I think really there are times and situations where that ends up being my goal because of how I can see it impacting people's symptoms. But I try to keep that out of my mind when I'm working with people for a variety of reasons, not least of which is thinking that I think it's too easy to fall into that being like the end-all be-all goal, and then you can miss other significant achievements that people make along the way. And I also think that for many people, and especially young people, the idea of like abstaining and never using again is very overwhelming, and do think kind of how people in kind of AA's mantra of like one day at a time really makes more sense, and really trying to get as complete a picture of their use as I can. But again, as I mentioned, I don't think it's good for young people with psychotic disorders to be using cannabis. So, I would say, in terms of whether there's a difference between clinical high-risk subjects and first episode clients, I don't adjust my approach much. I would say I spend more time seeing about like odd and unusual experiences that they've had. I also would say that sometimes if someone who's clinical high risk like abruptly discontinues cannabis use, that's something that I really try to explore, because oftentimes I find that they'll have had a brief period where they were intoxicated and became more acutely psychotic, and that was frightening to them, and so they discontinued their use. But in general, it's the same kind of thing, and really focusing on like their values, what they care about, where they're at. Also developmentally thinking that like these young people are trying to figure out their identity, and for people who are clinical high risk, oftentimes they're already struggling with social interactions, and if in drugs and cannabis included in that has its own kind of subculture, it can be a place for people to kind of find a home and an identity in peers. And so it's also balancing like how do you want to maintain and support the healthy aspects of that in terms of having a sense of self and having a peer group without necessarily having the central focus of it be the cannabis. So in terms of the question of severity of symptoms, like I've very much found that people that I work with respond very differently. And there's one young man that comes to my mind that, like, seeing him earlier in the day was actually the best I'd ever seen him, and he came back a few hours after having smoked a joint, and he was a complete mess in terms of very, very prominent psychotic symptoms, quite agitated, and it was really stark to see the difference. I've also recognized times where, like, the same person responds very differently to using, and then finding that they completely switched either their means of ingestion or where it is that they're purchasing their cannabis from, or they got it from the same drug dealer, but it's just coming from a different batch. And in terms of, like, can it be more helpful than harmful to some? I mean, just my personal opinion is, I think for people with psychosis, unfortunately not. I think that there's lots of other instances, and for example, with lots of the young people that I work with who don't have psychotic disorders and really struggle more with trauma and affect regulation, there are often times where, like, I would much rather them use cannabis than other substances. In terms of really seeing if it's helpful, and this I didn't mention earlier, but, like, I personally have had big issues with kind of the whole idea of medical cannabis. Well, I've been okay with the idea of recreational cannabis, and my reason for that being just there's no good science because of the policies that have been in place. People haven't actually been able to do science. So I think that there are probably lots of things for which cannabis or components of cannabis might be helpful. I unfortunately don't think we know any of the specifics with any kind of accuracy. But I think it would be silly to think that there aren't any, and also silly to think that it can cure everything. Yeah, so in terms of the dispensaries, so right now in Massachusetts, there's only one in the Boston area that's Meta that I will often mention to people, just so that they have a place to go and an option. Actually, when people ask me for a recommendation, it's easy because I have an out and tell them that we're not allowed to give recommendations where I work for people to get their medical marijuana card. And that's like a good opportunity to say, like, in my medical opinion, this isn't like I just recommend things that I think are going to be helpful for you. But I will sometimes, like, look at the website with people if they have questions. And any other questions we can address via email. Thank you, everyone, for listening and to my first webinar. And thank you very much, Dr. Hansen, for being my patient.
Great, thank you everyone. So you'll be receiving an evaluation form for this webinar afterwards, and thank you all for joining us today.